Hi everyone, Dr. Nemechek here. Want to briefly touch on polyps. Now, what are polyps? Polyps are these, like if this is the surface of skin in some place in your body, they're these little growths that stick up, okay? And polyps are not normal. Polyps, when you see polyp means you got inflammation, okay? Significant inflammation. And that means you got inflammation, and polyps can be in your colon, your stomach, your sinus, in the uterus, in the bladder. Where else have I seen them? The nasal passage, and these are all driven by inflammation. Okay, and because what happens is the surface of your skin is supposed to slough off. All right, and when I say that, people are like, skin, well, the lining of the bladder has a type of skin, or what we call epithelium. The lining of the uterus has it. These are all forms of what we call epithelium or skin. I'll just use that word. And they're supposed to slough off, usually within a few days to 10 days, somewhere, depending on the organ, that these things slough off. But if it sloughs off, how do they grow? How does it stack up? Because it's supposed to be sloughing off. And that's from inflammation, does that. Okay, it prevents that normal process like that. And as most people know, that's why they get colonoscopies, is polyps can at times turn into cancer. Okay, and that's why people get they get these colonoscopies to clip away these polyps. But beyond that, if you have, say, colon polyps and they just keep clipping them away, you still have the inflammation, and the inflammation is what gives people strokes, heart attacks, diabetes. That's what kills people for the most part, is the inflammation. So, albeit it's good to have those polyps removed, if you lower the inflammation, they won't come back. Okay, and I've seen this so many times in all these different areas. People have these, they keep going back, they have to get the surgery again, and blah, 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 and the polyps keep coming back. We put them on the protocol, and it just stops. It'll just stop. And we've had some extreme cases. We had a sibling pair who have a genetic disorder called familial polyposis, and now this is where they have hundreds of polyps in the colon. They have to get repeated colonoscopies, several a year, and they're going in harvesting out 20, 50 at a time, okay? And it's kind of a race to keep up with the polyps so these people won't die of colon cancer. So I had this brother-sister pair, put them on the protocol, and over the next year, these routine kind of scheduled endoscopies or colonoscopies are getting fewer, and then it took about a year and a half for them, and they got down, they weren't having any more. They had a gap and no more polyps. And then I didn't see them after that. They were kind of off and running and doing their thing with the protocol. So you can stop these polyps from coming back if you lower your inflammation. Now the protocol is fish oil, olive oil, rifaximin, and a vagostimulator, okay? And you can prevent them from coming back. And then aside from that, the inflammation that's driving them, because the protocol lowers the inflammation, it'll dramatically reduce your risk of things like cancer, heart attacks, strokes, diabetes, stuff like that. Okay, so this inflammation's bad. Okay, and if you got polyps, that's a sign you got it, and you got to do something about it. Take care.